So I think firstly it's important to stress and understand what a hernia is. So as a very basic definition, a hernia is a weakness in the abdominal wall muscles for the intents and purposes of what we're talking about. So we see hernias in a number of sites. They can include the groin or near the umbilicus. And in terms of the symptoms that patients present to us with, they can range from just noticing a lump or a bulge. This is something that often appears when people are standing up more. And if we focus on groin hernias, so inguinal hernias mostly, patients say that when they're standing or if they strain or cough, they notice this bulge become more predominant. And conversely, if they lie down or gently push the hernia back in, the bulge disappears. So that's one thing that sometimes patients present with, just a bulge. But leading on from that, patients can actually complain of discomfort or pain that occurs either consistently all of the time or at times when they're performing more exertional activity. That pain can be directly where the lump is in the groin, or occasionally in men, for example, can radiate down into the scrotum or down the inner aspect of the thigh because of the nerves that run through the inguinal canal where the hernia comes out. So those are the main symptoms we see patients presenting with in our clinics, but then occasionally a hernia can present as a strangulated hernia, which is where something comes out and gets stuck in the hernia. And in that situation, patients can present quite unwell with a hard, painful lump, sometimes vomiting if there's bowel caught in the hernia itself. So the traditional teaching for hernias was that the majority of patients should have their hernia repaired. Things have changed somewhat over the last 10 or 15 years. And the feeling nowadays is more so that if hernias are causing symptoms, causing problems, then there's a stronger indication to have them repaired. So when I see a patient in clinic, we always discuss the options for management for a hernia. And that could include a conservative approach, i.e. not doing an operation. And for those patients, they can either manage as they're currently doing, or sometimes wearing some tight underwear if they have an inguinal hernia, just keeps things pushed back in. Some people even use what's called a truss, which is a support garment, which again, just keeps things pressed back in. It acts like the abdominal wall muscles. So that is an option. And the other option is to have an operation to fix the hernia. Patients generally opt for the latter, so an operation if they are getting symptoms, if they're getting pain. But there's also a reason for the majority of patients who have a hernia, if they're fit and well and not overly troubled by other medical conditions, to consider a repair, in that there is a small risk of the hernia strangulating, which is where something comes out, gets stuck in the hernia, and interrupts the blood supply to those structures, which are usually a bit of bowel, and that becomes a bigger procedure to fix as an emergency. So whilst some people do live with their hernias, the majority of people will opt for an operation. For inguinal hernias, there are two different ways that we can repair the hernia, either through an open repair, which involves an incision in the groin where the hernia protrudes, or through laparoscopic, also known as keyhole surgery. For the former, so for an open repair, that is something that is generally performed under a general anaesthetic, so with the patient asleep. They come in, have the operation done, and go home the same day in the majority of occasions. And we make a small incision where the hernia protrudes. It's a little bit more technical than this, but in essence, push things back in which are bulging out. And then we reinforce the abdominal wall by placing a bit of synthetic mesh into one of the layers of the abdominal wall muscles. And that is the standard of care for hernia surgery, to use mesh, although there are some non-mesh techniques that some people will use in certain circumstances. Once the hernia has been repaired, patients go home the same day, and then are encouraged just to not do anything too strenuous whilst the mesh is incorporated in the abdominal wall. So that's one technique. And the other technique involves keyhole surgery, where we repair it from within the abdomen. And there are two different techniques to do that, either one that involves entering the abdominal cavity itself, or one that involves going down in front of the innermost layer of the abdominal wall. But both are essentially the same procedure. Again, like an open repair, we use mesh to reinforce the abdominal wall. And as with open repairs, the way that mesh works is not really by providing a huge amount of strength to the repair itself, but your body creates a lot of scar tissue in reaction to the mesh being there, which is what creates the strength to the repair. Keyhole surgery, laparoscopic surgery for hernias is likewise done under a general anaesthetic as a day case procedure. So hernia surgery is probably the most common operation that general surgeons perform, and we would regard it as routine surgery. And the majority of patients have no issues, either during the procedure or post-operatively. So we would regard it as routine surgery. But in answer to the question as to whether it's serious surgery, I would say that all surgery, all operations are serious. We take all the adequate precautions. It should be carried out by a specialist with specialist anaesthetists and teams involved, because there are recognised issues that can occur with any operation, and that is the case also with hernia surgery. So trying to minimise the risks of those complications or issues is important. The majority of patients who undergo hernia surgery have it performed as a day case operation. So they'll come in, have the hernia repaired and leave the hospital the same day. They'll walk out of the hospital, and we encourage our patients to be up and about and active as much as possible immediately after the operation. However, we do advise restrictions on what they should and can do. And these would include not doing any heavy, strenuous activity, any heavy lifting, or going down the gym and trying to push weights for about 6 weeks after the operation. And this just gives time for the strength to develop in the hernia repair. Other things that patients often ask is, when can I drive after I've had my hernia fixed? And again, the answer is a little bit dependent on their recovery, but most patients are able to drive within about a week to 10 days. It's when they're able to get in and out of a car comfortably and do an emergency stop safely. And we usually advise our patients to inform their insurer that they are going to drive after having had an operation, albeit that they are at a safe stage to do that, just so that the insurer is aware that they're going to drive, and if they have a prang, they don't get some reason not to have cover. So they're the main things that we advise, generally building things up after their hernia surgery. But you'd be surprised. I've had some patients come back after a keyhole operation for their hernia where they've been out riding their bike the following day. Cyclists are a breed unto themselves who will often decide their own recovery. And that's probably going a little bit too quick, but it shows what is possible in some people.